Hi, hello, welcome to Future Nurses YouTube channel. So please subscribe and support our channel. So let's start today's video. So the first question is, what is the term for a device used to take the place of a missing body part? So options: pronation, abduction, external rotation, prosthesis. So device used to take the place of a missing body part is option D, prosthesis. So next, when a client has left-sided weakness, what part of a sweater is put on first? So patient is having left-sided weakness. What part of a sweater is put on first? Options: both sleeves, left sleeve, client's choice, right sleeve. So we need to put on sweater first on the left side, on the weaker part. So option B is the right answer. So next, it is appropriate for a nurse aide to share the information regarding client status with options: any one of the nurse aide sees fit, the client's family members, the client's roommate, the staff on the next shift. So she has to share the information regarding client status with, she can share with the staff on the next shift. Option D. So next, when helping a client who is recovering from a stroke to walk, the nurse aide should assist. Options: on the client's strong side, on the client's weak side, from behind the client, with a wheelchair. So option B is the right answer, on the client's weaker side. So next, the nurse aide is caring for a client who is agitated. The nurse aide should speak loudly so the client can hear the instructions. As to reassign the care of this client, talk in a slow, calm, reassuring manner. Tell the client to be quiet. Option C. Talk in a slow, calm, reassuring manner. So next, the purpose for padding side rails on the client's bed is to. So the purpose for padding the side rails. Options: use them as a restraint, have a place to connect the call signal, protect the client from injury, keep the client warm. So to protect from the injury, option C. So next, exercises that move each muscle and joint are called. Exercises that move each muscle and joint are called range of motion, ROM. So option B is the correct answer. So next, how can the nurse aide best help a client who is not accepting a loss? So options: leave the client alone, convince the client to accept the loss, encourage the client to talk, discourage individual activity. So option C, encourage the client to talk. So next, the Heimlich manual abdominal thrust is used for a client who has options: bloody nose, blocked airway, fallen out of bed, impaired eyesight. So Heimlich manual is for black airway, option B. So next, to best communicate with a client who is totally deaf, the nurse aide should smile frequently and speak loudly, smile often and talk rapidly, avoid eye contact, write out information. So option D, write out information, because the patient is totally deaf. So next, the nurse aide is asked by a confused client what day it is. The nurse aide should explain that memory loss is natural and date is not important, ignore the request, point to the date on a calendar and say the date, provide the date and then test the client later. So option C, point to the date on a calendar and say the date. So next, to avoid pulling the catheter when turning a male client, the catheter tube must be taped to the clients. Options: bedsheet, upper thigh, bed frame, hip. Option B, should be taped to upper thigh. So next, a nurse aide can assist clients with their spiritual needs by options: taking clients to the nurse aide church, allowing clients to talk about their beliefs, avoiding any religious discussions, talking about the nurse aide's own spiritual beliefs. So option B, allowing clients to talk about their beliefs. So next, a nurse aide must wear gloves when. So she must wear gloves when options: feeding a client, doing pericare, giving a back rub, doing range of motion ROM. So doing perineal care, she must wear the gloves. So next, when getting ready to dress a client, the nurse aide should get the first clothes the nurse aide can reach in the closet, give the client a choice of what to wear, use the clothes the client wore the day before, choose clothes that the nurse aide personally likes. So give the client a chance what to wear is the right answer. Option B. So next, if the nurse aide discovers fire in a client's room, the first thing do is, so if there is a fire in client's room, so what she has to do? Options: call the nurse in charge, try to put out the fire, open a window, remove the client. So first he has to do the remove the client, option D. So next question. In order to communicate clearly with a client who has hearing loss, the nurse aide should speak in a high pitched tone of voice, stand behind the client when speaking, speak in a loud and slow manner, look directly at the client when speaking. So she has to look directly at the client when speaking. Option D. So next, which of the following stages of dying is usually the final stage? So options: anger, acceptance, bargaining, depression. So the final stage is acceptance. Option B. So next, if a client says God is punishing me or why me, how should the nurse aide respond? Options: reply God doesn't punish people, listen quietly, ignore the client, make jokes. So we have to do is listen quietly to the patient. Option B. So next and last question, the role of the ombudsman is to options: run a group of nursing homes, work with the nursing home to protect clients' rights, control the nursing home budget, prepare classes that nurse aides take to learn about hygienes. So ombudsman role is to work with the nursing home to protect clients' rights. So friends, we have come to the end of the video. So please subscribe our Future Nurse YouTube channel for your upcoming AIIMS NORCET in 2024 and other competitive nursing officer examinations. Thank you.